Okay, so in this video, we're going to talk a little bit about some of the misconceptions that happen around EOTRH, and it can come from different sources. There's a lot of political tensions in the world of dentistry. A lot of veterinarians like to attack technicians. Some technicians like to attack veterinarians. What really matters is the quality of the work, the quality of the training, the integrity of the person practicing, those types of things. There's bad on both sides. Here, I'm not on social media. We make these YouTube videos and we put them out, but I know a lot of people in the dental world, and so invariably I'll get screenshots from things that are occasionally posted online. And some of it is so outrageous that it warrants making a comment, as in this case. So there's a post here that we're going to put up, and we'll kind of walk through it a little bit. But one of the things it says for EOTRH is that it can be treated with NSAIDs, which are painkillers, non-steroidal anti-inflammatories. And what those are is they're basically like Advil or Tylenol. So if you have a really bad tooth infection and you take a little bit of an NSAID, it's going to help a little bit. It's not fixing the problem, but it is helping you tolerate the problem a little bit. But it's also eventually hard on your stomach. It can be hard on your kidneys. There can be side effects over time that are not ideal. So we can't just use that as a form of treatment. The other thing it suggests is that antibiotics can help. And that's even maybe more ridiculous because antibiotics do not make EOTRH go away, and I'm going to show you why. It's really bizarre that in this day and age that we even have to discuss this, but to me, I see so many horses that hurt so bad with EOTRH. It's a terrible condition. It's very painful. There are some subtleties of it. There's slightly different types. There's some nuance. EOTRH is a broad term, but there's some form of EOTRH, particularly the form with the resorptive lesions, which is excruciatingly painful to horses. And anybody that's worked on a lot of horses and removed these infected teeth from these horses have gotten the feedback from the owners and seen the changes. I mean, I've been doing this 25 years, and I can't almost think of a single negative feedback that I've gotten from clients that have had the right teeth removed. And it can be literally life-changing for the horse. In fact, in many instances it is, especially with the resorptive form. So today we're just working, and somebody shared this post with me, and so we're just kind of wrapping up here, and I'll just show you some teeth that we took out just today. So we'll come over here, we'll sit down, and I'll show you some teeth and why do antibiotics not work. Well, first of all, infected teeth become a foreign body. So essentially it's kind of like having a bullet inside your body that's infected, or an infected splinter. Antibiotics will quiet down the amount of bacteria that are present, and it will reduce the expression of the infection, and that can make you think that you're making progress, but you're really not in a case like this. So for example, here's a case of more of a hypercementotic type of lesion, but we can see here, this is not what you should have on a normal tooth. A normal tooth should be attached to the bone, the alveolar bone, with thousands of what are called periodontal ligaments. This is a little bit more normal appearance here, but this right here, this is an abscess, okay? This is the capsule of an abscess. This is where there's pus being produced. This is very abnormal, very infected, and no amount of antibiotics are going to make this infection go away. This is another tooth on the same horse, and you can see it's broken because it was completely hollowed out. But you see this stuff right here? This right here, this is pus. This is cottage cheese inspissated pus. Large volumes of it inside of another abscess capsule. See this? This is that same type of capsule. And here. Okay. So this is how much pus is in here. Now inside of this region where the pus is, there's no blood supply. Why is that important? Well, for an antibiotic to work, the antibiotic has to be delivered to the spot where there's the infection. There is no blood supply inside of a wad of inspissated pus, okay? And so the blood supply can't get in there, the antibiotics can't get in there. The primary cause for EOTRH, which stands for Equine Odontoclastic Tooth Resorption and Hypercementosis, we don't truly know, which means that the antibiotics cannot be treating the primary cause because the primary cause is not an infectious origin issue. And so all we're doing with antibiotics is we're just masking some of the infection. Maybe it'll reduce the drainage. It won't make this stuff go away. So the reason why I speak out on this post is because it's ridiculous. It's really terrible information for the horse owners, because this could lead to a lot of unnecessary suffering on the horse's part. It spreads the false idea that somehow masking the signs is a good treatment, which is honestly a huge problem that we see with dental disease when it comes to sinus infections, dental infections, EOTRH in general anyway. It's an over-reliance on trying to treat it first with antibiotics when that doesn't really solve the problem. Antibiotics are an adjunct therapy that we can use to help control an infection or eliminate it while we're treating the primary issue, a broken tooth, whatever may be going on. So if any horse owners are seeing this information out there, just be really cautious. And if you don't believe me, I understand because you don't know me. So do an experiment. Put the horse on antibiotics like this post suggests. Actually, I would not recommend doing that. But if you're going to do it anyway, if you really don't believe me, you believe this other person, follow that and then stop and see what happens. And I promise you, every sign will return. And if it doesn't, then I will personally apologize, but I can guarantee you that it will return because I understand the disease process. So just be careful of what you read out there. On the internet, everything can look good. This post is based on no formal research. There's no data that suggests that antibiotics fix EOTRH or mouthwashes fix EOTRH or NSAIDs. And any veterinarian that understands pharmacology, physiology, and pathology knows that anti-inflammatories, antibiotics simply reduce the expressions of the disease. They don't make the disease go away, okay? So hopefully this all makes sense and you guys enjoy this type of content. Give us a thumbs up. We try to provide things that are relevant to everybody in the horse community.